Thank you very much. Thank you for joining me tonight. We're going to talk a little bit about low vision, some of the things that cause low vision. And as you heard a little bit of background on me, I am a medical optometrist. My area of expertise is fitting complex, medically necessary contact lenses, which can be for someone who has low vision, but these are usually people with corneal disease. But we're going to focus on the low vision for today. So what are we going to talk about today? What is low vision? What causes low vision? We're going to go over some conditions: glaucoma, macular degeneration, diabetic retinopathy. What are some symptoms you might have if you have low vision? How to get diagnosed? And what are the treatments available? And then what's coming up in low vision? Okay, so the National Eye Institute is a really great resource for someone who has low vision. And they define low vision as visual impairment that's not corrected by a pair of glasses, by a pair of contact lenses, by surgery, that interferes with your everyday activity. So if you go to your doctor and you get an eye exam and your vision is poor before you put a pair of glasses on, but with a pair of glasses it can be correctable to a certain level, that would not be considered low vision. It would be with trying every method, we cannot improve your vision. So what exactly is the definition? So not all practitioners really agree on this. There are varying levels. According to the American Optometric Association, someone who has vision of 20/30 to about 20/60 is considered mild low vision to normal. Someone who's 20/70 to 21/60 would be moderate low vision. 2200 to 2400 is severe low vision. And then 2500 to 21,000 is considered profound low vision. However, if you look at other sites and other places, you might get slightly different numbers. There's no exact measurement that's been decided. So when you go to the eye doctor, everybody knows that you have to have your vision checked, and that's where they cover one eye and they check your vision, then they cover the other eye and they check your vision. When you go to the eye doctor, normally this is the vision chart that you will see. Okay, and this is called the Snellen chart, but every doctor's office, that even your primary care doctor might have this eye chart. Now, if you go to a doctor specifically for low vision, usually they have the Bailey-Lovey eye chart. It's different, it has a larger scale. If you can see, the letters are a little larger at top. And then sometimes you might end up seeing this eye chart, which is the ETDRS, which is an eye chart that's from the early treatment of diabetic retinopathy. But the most common one you're going to see here is the Snellen eye chart. Okay. So who has low vision? And just so you guys know, February is low vision month, so we just passed it. So according to the National Eye Institute, about 4.2 million Americans ages 40 and older are visually impaired. 3 million of them have low vision, and they think that will increase to about 5 million by 2030. About 4.2 million, as I said before, are visually impaired, and they think that will increase to about 7.2 million. So it primarily affects the elderly, and approximately about 17% of people over the age of 65 are either blind or have some form of low vision. Well, one of the reasons we're predicting such a large growth is also that people are living longer, so that's something to keep in mind. Okay, so what is low vision a result of? What causes someone to develop low vision? Is it treatable, and can we slow it down? So the main causes, and this is just a list of the primary causes, it's not limited to, is macular degeneration, glaucoma, diabetic retinopathy, retinal detachment, having a stroke, some kind of trauma, blunt trauma to the eye, and cataracts. And the thing you should know about cataracts is that getting a cataract is like getting gray hair. We're all going to get them. It's nothing you didn't cause it, it's just the normal part of aging. A cataract is treatable, and you can get good vision after. The only time you'll develop low vision from a cataract is if you choose not to have the surgery to have the cataract removed. And a lot of these conditions, if they are diagnosed early, meaning you go to your eye doctor and you go for your yearly exam, there are treatments that can halt or slow down the development of low vision. However, once the damage is done, we can't reverse it. If you look here, this is an eye chart also from the NIH that kind of shows what the majority of age-related eye diseases are. And if you see this big orange is all cataracts. And we have a lot of diabetic retinopathy, a little bit of glaucoma, and AMD. Okay, so what are some symptoms of having low vision? It would be you would have difficulty doing your everyday activities. You might have a hard time reading. You might notice when someone's in front of you, you can't recognize their face as well. Cooking, driving, differentiating color. So you hear low vision, and then you hear the term being blind. And those are two separate definitions and terms. So when do you have low vision versus when are you legally blind? You're legally blind when your best corrected central acuity in your better seeing eye is worse than 2200, or you have a limited peripheral view of less than 20 degrees. So let me give you an example. If your right eye doesn't see anything at all, and your left eye can't read better than the 2200 line on the Snellen chart I showed you, that would be considered low vision. But if your right eye can read 20/30, but your left eye doesn't see, that's not considered legally blind, okay? Other definitions would be you see less than 20 out of 1,000, and that's considered near to total blindness. No light perception, meaning if I shined a light in front of your eye, you wouldn't be able to tell me if that light is on or off. That's severe visual impairment, total blindness. Now what you should know is someone who's considered legally blind might have some useful vision. It just might not be directly in front of them. They might have to turn their head. They might be able to see shapes and shadows, but they might not be totally black in what they view. And oftentimes people who are legally blind do qualify for government benefits. Okay, so macular degeneration. Macular degeneration is the leading cause of vision loss in people over the age 50. And what is it? It's an age-related degeneration of your macula. What is your macula? Your macula is the part of the back of your eye, your retina, that gets you your clear vision. So it's very important that that part stays very, very healthy. And what happens is you get a buildup of waste in that area that happens over time as you age. And that causes those layers that you're supposed to get the clear vision from to be irregular. This is a diagram of macular degeneration. If you see these spots that are there, this is kind of what the doctor would see, and this disrupts these layers. Okay, so who is at risk for macular degeneration? People over the age of 50, Caucasians, people who have heart disease, genetics, if someone in your family has had macular degeneration, smokers, people with light eyes. This is just reiterated in a better picture from the Lighthouse, the Guild, and the National Institute of Health, and who also gets macular degeneration, shows 89% of Caucasians, 5% of Black, 4% Hispanic, and 2% others. So there are two types of macular degeneration. There is the dry form and the wet form. 8 out of 10 people have the dry form. The dry form is less severe. You have a lot less vision loss. The wet form is less common, but your vision changes very quickly. Okay, so what are some signs and symptoms of macular degeneration? None. You could go to the eye doctor and they find the beginnings and you would have no idea. This is very common. Decrease in central vision, a dark spot in the center of your vision, something called metamorphia, which is when the vision is slightly abnormal and out of shape. Dimming of vision when reading and not being able to see fine detail. This is an Amsler grid. And this is a test that your doctor will probably give you to take home. You put it on your refrigerator. In the morning you wake up and you cover one eye and you look at it and you check to see if all the lines are straight. Do the other eye. Every day you do this. Someone who has pretty progressed macular degeneration will look and see distorted lines. So treatment options. Well, first thing is that you would be referred to someone who is called a retinologist, a retina specialist. This is an ophthalmologist who has specialized in the retina. As we said before, macular degeneration affects the retina, the back of the eye. Your doctor would give you an Amsler grid to go home with, that grid I showed you. You would follow up with regular dilated eye exams. They might give you some vitamins to use, diet, lifestyle changes, and unfortunately in very severe cases they will do injections into the eye. The most important things to take home, and I don't think you have to repeat everything I say, but the most important things is you got to avoid smoking. Smoking is one of the only things we've really figured out that can not cause progression in macular degeneration. And your diet, very important. So we're going to talk a little bit about glaucoma. Glaucoma is a disease where you have damage to the optic nerve. The optic nerve is in the back of your eye and it sends all the information to your brain. Okay? It's often associated with high eye pressure. There are many types of glaucoma. We're not going to go into detail, but there's a bunch of different types. And what will the patient complain of? Honestly, 90% of the time, nothing. If you don't get your eyes checked, you will not know you have glaucoma until it is so far progressed, you'll say you don't see well to your sides. So the one type of incident that can happen with glaucoma is something called an acute angle closure attack. I think the main thing to know is that if you have sudden onset, blurred vision, sharp, really horrible pain to the point where you are vomiting and you are nauseous, that you should go to the emergency room. If you just have some blurry vision or you just have a little eye pain, you should not go to the emergency room. They don't have the equipment to see you. But if you were to the point where you were sick and you were having a horrible pain, you should go to the emergency room. Treatment options for glaucoma. There is no cure for glaucoma. The main treatment is eye drops to lower the eye pressure. The eye pressure is the only thing we've been able to figure out that if we decrease the eye pressure, we can slow down the progression of glaucoma. If the eye drops aren't working, then we have to go to surgeries and to lasers. Right now, there's about 2.7 million people with glaucoma, and they predict in 2050 there will be 6.3 million with glaucoma. What I tell my patients when they are worried about glaucoma and they ask what they can do, the most important thing you can do is go to your yearly eye exam. Okay, so diabetic retinopathy. There are two types of diabetes. There's the type 1 that is usually in younger patients, and type 2 that is usually in slightly older patients. Okay, so number one, say you don't know you have diabetes and you go to the eye doctor and they tell you you do. A lot of the times they're just going to watch you carefully. If you have more severe diabetes, they're going to send you to a retina specialist, someone who focuses on the back of the eye. And the treatment for diabetes can be laser, injections, or surgery. Diabetes can lead you to blindness. It's a very serious condition in the back of the eye, very serious. So the next topic is a retinal detachment. So our front row lady here was talking about seeing a spot in her vision. So what would you see if you had a retinal detachment? You might see flashing lights, dark spots in your vision, loss of vision, or distorted vision. So what do you do if you notice one of these things? You immediately see either an optometrist, a general ophthalmologist. Either one of those is fine. Because a lot of the times you don't have a retinal detachment. You might have some other conditions. What we described kind of before with the black spots is called a floater. Okay? But the take-home message is if you see flashing lights or new dark spots in your vision, you go to your eye doctor immediately. So cataracts. What are cataracts? Cataracts are the clouding of your natural lens. You are born with a lens in your eye. As you age, it's exposed to oxygen, it's exposed to the sun. And that's how you develop a cataract. Who gets cataracts? People over the age of 40, someone who's taken oral steroids, someone who had trauma to the eye. And usually people say their vision is blurred or they have some glare. So what are your options? Your options are surgery. And nowadays surgery is you go in the morning and you're out in the afternoon. And it's a very easy procedure, and the doctors who do it are very, very good at it. It's not something you should be scared of. It's something that is inevitable, and if you don't have surgery, you will end up losing the vision in that eye if you live to a good long life. So you have low vision. How do you approach it? So your doctor informs you you have low vision. What can you do about it? So the first thing is to figure out what type of low vision you have. Do you have poor central vision? Do you have poor side vision? Do you have general blurred vision or a general haze? Are you extremely light sensitive? When you go into a normal lighted room, can you not handle the pressure of the light? Or at night with the moonlight, can you not see? It's so dark. So if you yourself have been diagnosed with low vision, the most important thing to do is that you want to stay as independent as possible. You want to make the most of what vision you have. So that means you have to turn your head to see better. You're going to start doing those things. And if a family or friend has low vision, you need to try to understand what it would be like to have low vision. And the last thing you want to do is start doing everything for them. You don't want to take away their independence. So who are some professionals that can help you? This is a list of all the different types of professionals: ophthalmologist, optometrist, occupational therapist, rehabilitation teacher, orientation specialist, social worker, counselor. And if you see here, the Lighthouse Guild is the main place in New York City to go to as a resource. Some resources and services. There are a lot of new technologies out to help people with low vision. We'll go through those. There are support groups. There are devices you can buy. There is training. People can come to your house and actually set you up to help you. And there are mobility services. Now, are these free? Some of them can be billed to Medicare, and some of them are, you have to pay out of pocket. So let's talk about some vision aids. The first thing is magnifying spectacles. These are worn like glasses, and they increase the size of font. Stand magnifiers. These actually stand on the table and have a magnifier, and you put what you want to read under it, like this person is here. This is the stand magnifier. They're trying to read their checkbook, and it enlarges the image here for them. Hand magnifiers, some of you can buy these. You can buy these, anywhere, Dwayne Reed. But there's special ones that have more power in them, and they also, a lot of them, have a light attached. So if you work with your doctor, you would find the one that's right for you. And then there are telescopes that can help you see things very far away. And video magnifiers. These are pretty incredible. And what they are is that you actually put it over the font you want to read, and it magnifies it. And it gives good contrast between the background and then the color of the writing. And we're going to talk about a couple of things that are being developed, but new devices are being developed daily. So devices. Oftentimes for someone who has low vision, an audiobook is a really good option, taking away some of the need to be able to read everything, but also to be able to be stimulated. Or electronic books, Kindles, Nooks, iPads. The great thing with this is that you can increase the light or decrease the light, and you can increase the size of the font and how thick the font is, making it bold. And there are apps actually out there that have been developed. The iNote is a good one that have been developed to go on your smartphones for people with low vision. And these are some of the electronic devices. They're actually closed circuit TVs, but we're not going to go through all of them, but there are a lot of them, and there's some in every shape and every size. So there's some that you can actually put in your pocket and bring with you, to work or on the subway every day, so that you have something to enlarge. And this woman is actually using one. She's doing the crossword puzzle, which is right here with her hand, but she's seeing the image enlarged on this screen. Some other devices are computers. There are computers that will read out loud to you. It's kind of like an auditory thing. And then also watches. Watches where you can press on them and it will say the time. Blood pressure cuffs, blood sugar machines. Other things, large prints. There are. If you go online and you Google low vision, the amount of resources that come up is an extraordinary amount. There are multiple places that you can buy enlarged print books, magazines, playing cards, bank checks, and also there are telephones and watches and thermostats and remote controls that have larger numbers on them that would make everyday activities much easier. Other things that you should do is, if you have low vision, or if one of your friends says, you should go through the house and change the light bulbs into a higher wattage. Increase the light in your house and in the rooms. Add lamps to areas that you don't have good lighting. If you have low vision due to glare, there are clip-on glasses, and you can also ask your doctor to prescribe you tint for your glasses, so when you go outside, things are not as bright. Other things that are very important is creating contrast or a difference in color. So if you have your kitchen table, you use a red tablecloth and white plates. If you have a white piece of paper, you're going to use a thick black marker to create a contrast between the two. There also are devices that actually have a black piece of paper that has a slit in it that you can lay down on top of what you're trying to read, so it isolates the line for you. So, I think the best resources, there's maybe one in New York and one overall, and I think the National Eye Institute is probably the overall best resource. And if you go to their website, they actually have an entire book you can download on living with low vision. I actually asked them to give us copies, but they don't do that anymore. But you can download the entire book for free. And I'm sure you would be allowed to print some things online here if you wanted. And it kind of walks you through what it's like, and you could get a better idea of your resources or what it's like for someone else who has low vision. And the other resource is the Lighthouse for the Guild. That is here in New York City. Right now it's on West 65th Street, right next to Central Park. And why is this a good resource? They have everything you could need within this one building, and they have every person you could need. But also they will get you registered for lists that will also reach out to you with other resources. And lastly, some new devices. And if you go to the Low Vision Rehabilitation Services, they have all the technology on this website, and they have a lot of the new stuff. But this is the newest one. If you see, this is a dad and a son, or a grandpa and his grandchild. And they have the picture actually located here, but it is displayed in a magnified view on the screen. And then down here, this is a portable screen that if you actually put it on top of something you want to read, it enlarges it and increases the contrast, and you can scroll and everything on it. And lastly, iGene is the National Ophthalmic Disease Genotyping and Phenotyping Network. And this website has all the research projects that are going on to try to help change things for people who have low vision. And actually here at Columbia, we have multiple doctors in the Eye Institute that are working on stem cell research and trying to figure out ways to help people who have low vision and also help predict who will have low vision.